We're going to do the positions all in one package. So you have RCP 19, 20, 21, and 22. The first position we're going to go through is supine. Supine is where they're laying flat on their back. Supine position is good for bed bath, range of motion, bed change, doing skin checks, and they need to be flat on the back for perineal care. So those are just some of the positions that that are some of the RCPs done in this position. The next one we're going to do is lateral. So there's a few different things about lateral. If you are turning somebody laterally in order to do a procedure, you want to be sure that the rail is up on the side of the bed that you're turning them to, so they don't roll off the bed. If I am just going to turn her onto her side, say like for a back rub, then I would have her bring the opposite leg that we are turning toward would be on top. Bring her arms up, and I'm going to log roll her on 3, 2, 3. There you go. So this right here would be fine in order to do a procedure, but if I was going to leave her this way for a couple of hours, I wouldn't want her face right up against the rail. So I would need to move her to my side of the bed, put my hands under her thighs, bend your knees up, and your shoulder blade, and on the count of 3, you're going to move toward me. 1, 2, 3. Okay. Then I would turn her onto her side, and I would need to place pillows. So I would have a pillow underneath the head of the bed. I would have one right here so that she can support her arm with it. I would use one to put between her knees and ankles. So if she is a tall person, you may need 2 pillows in order to get this accomplished. And then I would put one behind her back. So depending upon what you're wanting behind her back will determine how you place it. If I was just wanting to take the pressure off of her back, her tailbone, then I could do the pillow just flat. And that way she could still come back some and not be totally onto her side. If I need her up on her side, I could fold it like this. And that way it gives her total support while she's on her side. That is lateral position. Thank you. Let's go on to Semi-Fowlers. Maddie, can you go ahead and lay onto your back? Okay. So with Semi-Fowlers is the comfort position. So things we would do in lateral would be turning an unconscious patient laterally in order to do oral care, doing a back rub, doing the back side of the perineal care whenever you're doing a bed bath. Your skin check, you may need to turn them over in order to see that. You may need to turn them on their side in order to place them on a bedpan. So there's many reasons why you want to use lateral, but I wanted to show you the lateral position for long periods to make sure that they're properly set up and supported. So now we're going to go to Semi-Fowlers. Semi-Fowlers is 30 to 45 degrees, and that's considered the comfort position. There are no RCPs that are conducted in the Semi-Fowlers position. So this is the one that's primarily for comfort, and it provides the least amount of pressure on the tailbone. And the last position we're going to do is Fowlers. Fowler's position is 45 to 60 degrees. This position would be used to do hair care and brush your teeth, feeding, assist to feed, shaving. I think that's about it. So this is Fowler's, and that's 45 to 60 degrees. So depending upon the RCP that you have to do, your patient's comfort level, you'll determine the best way to position them. Thank you.